All right. Yes, Viet, we can. All right, well, we'll go ahead and get started. I'm John Strite, the managing editor and writer for Operation Smile, and alongside my colleague Laura Gonzalez, our digital content manager, we spend a lot of our time following our COVID-19 response and now our phase back into activity around the world very closely. And we're really pleased to bring our panelists to you today for a really great conversation on how we've been able to resume surgery safely in both Italy and Vietnam. We're really excited about that and understand the level of undertaking that has transpired over the past several weeks to bring people the surgery that they need and deserve. My colleague Laura will be moderating the chat portion. Do you mind giving people a heads up on how they can engage?
Sure. Hi, guys, and thanks again for joining. There are two options for interaction. There's the chat and then there's questions. I encourage you to input in the questions category, and then at the end, once we hear from Ruben, Viet, and Domenico, we'll go ahead and have a live Q&A portion.
Awesome. All right, so we'll dive right in. I'd like to introduce our panelists today. We have Dr. Ruben Ayala, Operation Smile's Chief Medical Officer. Ruben is a physician and public health specialist from Panama with 25 years experience with Operation Smile. He first became involved with the organization as a student volunteer and has served in many programmatic roles before reaching his current position as Chief Medical Officer. He is also the current president of the Permanent Council of the Global Alliance for Surgical, Obstetric, Trauma, and Anesthesia Care, and represents Operation Smile in the Global Initiative for Children's Surgery, the World Health Organization's Global Initiative for Emergency and Essential Surgical Care, and the United Nations Economic and Social Council. Welcome, Ruben.
Good morning. Thanks for the opportunity.
Absolutely. And we have Dr. Domenico Scopoletti, maxillofacial surgeon with Operation Smile Italy and Smile House Rome. Dr. Scopoletti, hi Domenico. Dr. Scopoletti is the director of the maxillofacial surgery unit at San Filippo Neri Hospital in Rome. He has served on over 40 Operation Smile medical missions and also serves as a director of Smile House Rome, a comprehensive cleft care center. He has served as the president of the organizing committee for the Roman Days on Maxillofacial Surgery, the president of SMORRL Hospital Medical School in Rome, Lazio District, and the Italian Society of Cleft Lip and Cleft Palate, and is a selective reservist of the Italian Navy. Welcome, Domenico.
Hi everyone.
And we have Viet Nguyen, Regional Vice President of Development for Operation Smile in the Asia Pacific region in Operation Smile Vietnam. Viet is the Regional Vice President for Development and the Chief Representative for Operation Smile in Vietnam. He holds 24 years of experience serving Operation Smile in different positions and capacities and plays a vital role in the growth of the organization in the Asia Pacific region. He's a longtime member of the American Chamber of Commerce in Vietnam and currently serving on many boards of many Vietnamese student groups. Welcome, Viet. Thank you for joining.
Hi, everyone. It's a pleasure being here with you guys today. Thank you all the way from Vietnam.
Yes, and thank each of you for bringing your insight and expertise to the table, and thanks to everyone who's joining us today. We're looking forward to this. So we'll dive right in. Ruben, our first couple of questions are for you. In March, Operation Smile made the decision to postpone surgeries amid the COVID-19 pandemic. Could you tell us more about the factors that led to that decision? I know it was a very fluid and complicated emerging situation at the time.
Surely, and to preamble that answer, I would just go back to two areas that I've seen historically in Operation Smile that made me really believe in the power of the organization. One is the utter commitment to offering help to people in remote access or without the ability to reach that care, and the other one is the huge safety culture that the organization holds around the world. And a commitment to implementing that safety as we roll out any interventions. So when we had to make the decision to hold activities, it was a difficult decision from the sense of we realized that we're having to stop things that people receive that they believe and we believe are hugely impactful in the lives and the well-being of the children and communities. And at the same time, when you look into the safety aspect, it was almost unavoidable, and we feel it was the right decision at the time. So some of the things we wanted to do was definitely protect our patients, our volunteers, our staff, our partners, and our communities from the potential impact of COVID-19. We saw the deteriorating sort of epidemiological profile. So the virus started to spread at a rate that really opened our eyes, and it was right in front of us. We normally, in order to achieve the goals of taking care of hundreds and hundreds of children, we end up mobilizing a lot of volunteers from the countries, from different parts of the world. We end up mobilizing communities and families towards a place where we can converge and offer the interventions. So we realized that doing that in the midst of the potential threat of an outbreak at that time wasn't probably the right thing to do. And we did not want to be responsible for introducing the virus either into a country or into a community, or worsening situations in countries that were already starting to deal with the virus. The other part was the virulence of the agent, so, and the perceived lethality of the virus from what was originally observed in China and as it spread towards Italy and other places. Also, this was a new thing. This was a novel virus. So the response from different countries and governments and leaders was pretty fluid. There were changing situations with countries deciding with evolving responses, with governments restricting travel, restricting specific travel for specific countries or populations, the way in which the quarantines were being put forward for those with either symptoms or potential exposure, which made us really believe that it was going to take some time to have sort of a cohesive approach towards prevention. And ultimately, it's just a desire that whenever we work with people in the communities to take care of children, we realize that we're coming together and using our time, our talents, our resources to do this together. And we realize that countries were now having to be faced and communities were having to face this new agent. And we did not want to overburden or disrupt efforts in the preparation or response to COVID-19.
Yeah, absolutely. I know safety is, one of the major underpinnings of this organization. So it completely makes sense that we would want to contribute to that how we can in the midst of the pandemic. But shifting back to the topic of cleft surgery, obviously we want to keep people safe and prevent the spread for the virus, but cleft surgery is essential for those who need it. Could you speak more to why cleft surgery is essential, and then what factors are we taking into consideration when determining how we can resume surgery safely, while COVID-19 is still out there?
Yeah, let's just apart from the fact that from that initial discussion up until this point, the initial decision to stop up until this point, a lot has happened in a very short few months, which seemed like an eternity to so many people. A lot has happened. So there's now a lot of more awareness of and knowledge about COVID-19. There's also a greater awareness of what we don't know, and we're actively trying to get answers for every day, and even greater connectivity between providers who are trying to come up with solutions to some of the challenges that are posed. So our initial response, we believe fervently that it was the correct one. And we believe that the conservative approach to even resumption of activities is still the correct one. But let's also put things into context. And let's apart from the fact that the choice to not provide care to people, either surgery or comprehensive care, it's not a benign one. Children are still suffering because of it. So we have to start asking the question of how much of that suffering can we overcome, or how much of that suffering can we alleviate in the short, middle, and long term in the midst of challenges that COVID-19 poses to the world. So the reality is that the longer we wait, the longer more children are going to have difficulties eating, speaking. There will be issues in their growth and development. And we also need to avoid the suffering that might come from issues such as malnutrition and all that it brings for children who are suffering from cleft lips and palates. The constant mild ear infections and upper respiratory issues, stunting in growth. There's a plethora of things that in the short term you can probably say, hey, let's give this some time. But over time, the longer you wait, the longer you miss our opportunities on truly help, and the more likely you are to perpetuate the negative impacts of their suffering. And so you're going to have to weigh in the pros and cons and really start to think of what are the things that you can do. So we need to step back from the all or nothing approach to one that is a bit more based on the knowledge that is constantly evolving and the awareness. So today, we have the ability to really start looking at the epidemiological data that is available for countries, provinces, regions, and communities. We have the ability to look at the systems that have been able to be put in place to track and trace potential people exposed to the virus. We have the ability to understand which areas, countries, or communities have the ability to test and match that to the epidemiological profile of those communities and understand the predictive value of that testing. We have the ability to understand now a bit more about the ability of different countries to cope with an emergence, to cope with a potential resurgence, and whether our interventions do not take away providers from a potential necessary response. We also have the ability to continue to strengthen our partnerships with local entities, ministries of health, departments of health, members of the private sector, members of civil society, to figure out a way forward. We also have now have had a chance to look at human resource availability to offer assistance and to offer guidance and support to our foundations at the local level, and to get feedback from them as they're sort of dealing with the challenges. There's also the ability to provide ongoing surveillance. So as we start some activities in different places, if we are committed to the surveillance and we see some challenges coming our way, we should scale back just as we did before. Having a very comprehensive review of the evidence for the improvements that we can put forward and are applicable in the context of the communities that we're working with. So all that to say is we can step back from the all or nothing response, start to understand what is happening in a specific area, and use the arsenal of knowledge, of the ability to respond, of the ability to prevent, and the resources that we can put forth to make a decision of how much of the suffering we can tackle in the short, middle, or long term.
Excellent, thank you, Ruben. That leads us right into Viet and in Vietnam, where we've been able to resume surgery much further ahead of the curve than we would be able to in many other countries, and that relates directly to all the factors that Ruben was just speaking to. Viet, in May and June, we provided surgery for 202 patients in Vietnam, and those are our first surgical missions back since postponing still to this date almost all of our programs around the world. But you were the first ones to be able to get back in and provide surgery for children in Vietnam. We know you worked closely with the Ministry of Health to prepare for the mission last month, but what were the factors that led to the decision to be able to resume surgery?
Thank you for the question. This is a great question. As you might know, we just resumed our normal surgical activity about a month from now, a little bit more than a month. And there was about more than 200 surgery that our medical team in Vietnam has been able to perform, and bringing positive changes to these patients and family. To be honest with you, the first 6 months of we call the COVID year is very challenging for all of us. It's not just for us here in Vietnam, but there's I'm sure there's for many of you outside of in the other side of the world as well. But I think the reason we were able to step by resume our activity in the country, there's different factors. But I think the first factors that would allow us some confidence to get back into this kind of work is pretty much, we've been seeing that sort of a very safety, the safe environment in the country. As you might know that, in Vietnam, as of today, there's only 335 positive cases in the entire country for the last, since the pandemic was started. No death, and there's no new cases in Vietnam for the last 60 days, which is close to 2 months. And then I think that the Vietnamese government plus the Vietnamese people who actually using a lot of control measures. That's like, we immediately closed the borders, preventing from people from flying up from overseas into the country. We also make sure that everyone who's getting to arrive into Vietnam gonna take 14 days in the camp for the quarantines, and also have to be self-quarantined for another 14 days at home. Everyone has to do the test for the symptom of COVID-19, in case that they have contact with all the positive cases. So I think that the first factors actually allow us to go back and to resuming our work is actually, we'll feel that it kind of, as of now, kind of safe environments in the country. The second factor is, I think, regarding to the way that we'll, when the COVID pandemic has happened, it's changed everything in the country. It changed the way the world thinking about a pandemic. It changed the way that people, working daily. It changed our habit. It changed everything. I think that is also lead to the fact that every single hospital in the entire country, there's 1,400 hospitals in the entire country, has to change its ways of setting. Instead of just like letting people to go in like normal, now you have to set up the isolation areas, isolations area. You gotta provide a must to provide the PPE for all the doctor, the medical professionals is working in their hospital. So I think that's also it's required the actions, the prompt action from every hospital in the country, and also the prompt action from everyone who actually go into the country. So that means it creates more of a safety environment for us to go in if we resume our work with our partner hospital in Vietnam. Some of the hospital actually, as requested by the Ministry of Health of Vietnam, they have to turn the hospital to be ready or to be the COVID-19 hospital, which is with additional, requirement from the health sector or the Ministry of Health of Vietnam. The third factor I think that's also allowing us to go back and work is actually we strictly follow all the guidelines from the Ministry of Health of Vietnam, and we kind of hearing it, seeing it day by day. Depends on the situation. How has it been progressing? And then, the Ministry of Health of Vietnam will allow us and kind of turn on the green light for us to go back and resume our work. That's how we were able to do the very first missions in May in Hanoi. And then because of all the successes that we were able to achieve for that sort of mission, include the safety measurement, now we're allowed to continue with our second mission in Ho Chi Minh City. And it led to the fact that we were able to provide more than 200 surgery for these people, and continue to do more in the next couple of months. The third reason I think that actually from the operations, my perspective, but also I think that's from because the first 6 months we would not be able to do anything. We focus on being safe, staying well, and taking care of ourselves and sort of thing. So we foresee that the demand for these sort of surgeries is still very high. Particularly for this time of the year, it's the summertime, so kids doesn't need to go to school. They're gonna finish the school very early. People keep calling to our hotline and making sure that try to ask when we're gonna be able to resume our surgeries and our daily work. So that's how we kind of consult with our Ministry of Health of Vietnam and also the partner to make sure that we be able to bring them back with the Malisa, Ministry of Health, and extra. So I mean, overall, I think that there's a couple of factors that we can simplify. That's actually first of all, it's positive progress. We feel safe. We strictly follow the guidelines. We're making appropriate decisions. We're actually doing a great collaborations with our in-country partners and also with headquarters of operations in the US, and we do it at the right time. So that's all the factors that bring us back into the resuming our work in Vietnam.
Amazing. And Ruben, are there any other countries where we're looking at resuming medical or education programs soon? Or is there anywhere similar to Vietnam that we're looking at?
Yeah, so China is another example where the government of Yunnan, which is a province towards the southwest part of the country, has requested Operation Smile to restart its work with additional measures in place. They haven't had a COVID case in over 2 months, other than what they would consider an imported case. Their schools are open. They're coming back to their normal activities. And yet, when we look at China, we watch the news and you see that there might be some activity in Beijing right now and some concerns of potential respread of the disease, which do make us really evaluate. But at the same time, if we put things in perspective, Beijing to Kunming, we're talking about a distance of about 1,400 kilometers, which will be the equivalent of someone from Florida flying all the way to Bogota, Colombia. So we do have to acknowledge that there's potential threats, but we also can continue conversations with that ongoing monitoring on what can be done in a place where there hasn't been contagion of any magnitude, and people are coming back and believing that we have potential ingredients to resume that activity. So that's one. Morocco has resumed their activities at their center, non-surgical activities, in a very step-by-step fashion, following some very specific protocols and quite strict guidelines imposed by the government as well. And if we look at the epidemiological profile, they're no higher in cases than they're very close in cases to the one of Australia, for instance. In Australia, if you know, they have the bubble between Australia and New Zealand of sort of travel and communication. And we have other countries such as Guatemala, Dominican Republic, Nicaragua, and others who are looking to reopen their centers in the next few months. We are having really careful and thoughtful discussions about the projected activities, the level of activities, and how that might be impacted given the human resources, the need of the patients, the setup, the epidemiological profile of the places where they're located, and much more. So again, the common theme is we're hopeful and we want to reach our children, and because we're committed to them and to their well-being, and at the same time, the safety component is critical for us. And the same things that made us at some point halt activities are things that we will continue to keep in mind, even as we look to reopen some of these activities as well. So we are responsible to the communities and the countries, but also responsive to the needs of our children.
Well said, Ruben. Thank you. Domenico, when COVID-19 reached Italy, I mean, it was a really hard hit for your country, as we all know, and I know it deeply impacted the care you're able to deliver at the Smile Houses across the country, all 4 of them. Tell us more about how COVID-19 impacts that delivery of care when it first reached those really peak levels.
Yeah, you can imagine that here in Italy, we have to face the pandemic event 3 or 4 months before the Western country, and maybe at the same time of some Eastern country. But the impact in Italy was unpredictable because we are not ready in terms of face the emergency. So at that time was very dramatic event that obliged us to immediately, in 2 days, reach to the totally lockdown of all kind of activities. So the public health system allowed just to continue the emergency tumors and other services that are not possible to postpone. But the routine activity, including emergency activity we are running with the project of Smile House in all the Italian territory, was blocked totally for 2 months. So we have to take a decision, because as an organization that make a program with the public health system, we have two options: rest hands on and wait the finish of lockdown and suspend any kind of helps. But it's not possible, because you imagine it's not just surgery that we provide, but the entire path that follow the kids from the pregnancy until the end of the growth. So we take the responsibility of a wide range of patients and the family that we have to follow. So we took the decision, from one hand, to support the emergency and the pandemic event in the hospital where we have a Smile House. So providing to any kind of PPI, supporting the civil protection agency with a donation, and supporting our staff of volunteers that suddenly was involved in treating emergency to face the COVID infection. The problem that we have to on the other hands, we provide with the other kind of activities, so video call for speech consultation and for prenatal diagnosis and pregnancy support to the family, and supporting with other kind of activity our group of volunteers that are and all our volunteers are professional involving in the public health system in Milan, Rome, Vicenza, and other cities. So in the other hands, we just to help the doctors that are not routinely involved in emergency, to training them, because they have to face to do something that they are not able to do in their routinary activities. So we organize a training course online on diagnosis and treatment of patients affected by COVID, that was dedicated to volunteers, and was online courses that benefit over 200 people. And we do also a webinar, international webinar, on treating patients with antithrombotic disease for Operation Smile with our volunteers, Professor Violi from University of Sapienza. It was an experience that was benefiting many centers, because as they discover the pathogenesis of the COVID was a dramatic change in treating those patients. So we also did a teaching course for a European association of medical students, and just to training to maintain the attention on the activity of Operation Smile. And we did also 5 webinar orthodontic care for Cleft patients, headed by Costanza Meazzini, on orthopedic treatment, orthodontic care in Cleft patients, and other topics that are interested in the volunteers. So because for us it's very important to continue training people and teaching them to create this network, a national network that support the Smile House project in all the entire country. So the criteria at that time was just to have the time to realize the second phase, because during the emergency we are projecting how to continue, because we imagine that the emergency will be over not soon, but very we hope that should be soon. So the project is how to face a journey before the time of the vaccination, how we can run, how we can restart. I very often use a term of navigation, because when we describe our journey, that we going, imagine that we going to the point A to the point B, and the COVID pandemic event move our boat from the point C. So the route is totally different. So we have to reproject another route. So we have to provide another, to rethinking the entire path to arrive to the point C. That is very important, because it's not a simple restart. We have to consider that is a new way to face the problem, because as mentioned, as Ruben mentioned, we have to provide with more careful. We have to be more careful in safety, considering the consequence, medical legal consequence, if we spread out the pandemic, the virus, thanks to our activity. We have to protect the entire path, and protect the patients, the family, and also the medical staff. So when we have to create a new criteria. We have to respect our job, because we can't wait so long time, because everyone knows that if you treat patients with the cleft deformities, we have to respect and to be on time. Timely surgery is very important, because if you do the right job at the right time, you reduce the risk of have a functional consequence. So it's important that respect that time, because if we promise that to operate all the kids, the newborn kids, in the first years of age, we have to maintain our promise, and in any way, because otherwise we're gonna have a consequence. So when we reproject the new activity, and restart with the activity, first of all, we have to block any kind of possibility that the virus come in. So we have to imagine a totally COVID-free activity as much as possible, obviously, because to protect the 90% is very high aims that we would like to achieve. But normally we can protect, because it's an experience of hospital for that treating patients with infection, that there is a way to protect the people that work there, and the people to protect a path, an entire path that selected the area where the virus cannot spread out, that cannot run away. So first of all is creating a specific area, COVID-free. That means every kind of test has to be performed outside of that area. So testing people, the general criteria, even in the peak of the pandemic event, or in the phase 2, the important thing is to maintain out as much as possible the possibility of contagious in the area, in the safe area. That means testing has to be performed before, and the criteria that suggest all the epidemiology suggest that to test, tracing, and treating, and all these things has to be performed before the access of that area. That if you test, you reduce the risk of the people come in with a high potential infection that can be dangerous for the entire area. The second thing is to change any kind of DPI. The people that come from abroad and ask to be and try to have access to that area, normally, even in this time, comes with their personal PPE. That means that they wear guns or mask that they comes from the home, but they can be contagious in that journey that comes from the house or before to have access. So we do test, change the completely their own. They give and we give our personal PPI, and we save in a specific plastic bag all the personal items, personal belongings, and any kind of things, just to reduce the risk of contagious with the items that they carry out before to have access. Then they have access in waiting area, and one by one have access to in the ambulatory services. This is for the ambulatory services, and there is two different way to in and out. So it's not possible to go out from the same access when you come in. This is different door of entrance and way out allow us to reduce the risk that you can bring out and in people. Even for the doctors is obliged to do this kind of access. So for the medical staff, they have to change every time the personal protective equipment every time they change patients. So it's very important, and even also the contamination of the entire area is provided by the hospital, but there are personnel that dedicated every time the patient change to provide a time to make another decontamination procedures before to have access to the other another one patients. So, but for the surgery, the things is a bit different, because you know that there is scientific proof that if you treat patients, even asymptomatic patients, but COVID-free positive, the risk and serological risk is very high. So for all the patients that going to be undergo to the surgery, we require a negative swab for patients 48 hours before the surgery days, and we prefer to have the patients the same day as we have a negative results of the test in the ward. That allow us to have the total control, because if the area is safe and the patient is negative, the access is correct. Then the serological test has to be performed even for the parents, the one parent that is allowed, or the guardians, but just one, and has to be performed, is more fast to have results, and we oblige to even to the parents and to have the test, the serological test, before to have access to the hospital. So even during the recovery time, we oblige all the people to leave personal clothing and items in safety bags. So nobody has the opportunity to bring their own items, their personal belonging free in the area. Giving personal PPI for patients and other person, and maintaining always the social distance even in the ward. So in the ward where we have normally 4 people, we have just 2, and in the rooms when we have access to 8 people, we accept maximum 3-4. That is very, very important, because we consider, even if it's safe and we follow any kind of procedures for decontamination, it's very important to still to maintain the social distance. So for the medical staff, we are adopting, it's not so important for the kids that are performing just the cleft lip and palate, but we are obliged to treat even other patients that can perform other surgical activities that require the use of drills and or cautery or other things that they produce aerosol. Aerosol increase enormously the risk, even during the intubation of the patients, so at the time at the start of the surgery, and even during the surgery. So we oblige even I think that you have slides that show that. I don't know if you can show. There is a specific helmets that was invented first of all from the orthopedist that you can see. This is specific guidelines suggested for anesthesia for surgical staff, plastic surgery staff, maxillofacial. Are produced by different company. With these helmets, it's a stereo full head cover system with active air filtration to protect the clean room and provide to user comfort. It's very comfortable for the surgeon to wear this kind of helmet, but it's very safe because we don't have any kind of contact of external ambience, and protected totally from any kind of aerosol producing during the surgical time.
Wow.
So
that's amazing.
this is very, very useful. And we have another personal PPI that I would like to share with you. Was invented for the NASA, for the aerospatial station, and produce oxygen peroxide and give a decontamination area 90% of decontamination from any kind of bacteria and virus. This is disposable that can use as a personal. You can wear and create a zone, a free zone, safety zone of 5 cubic foot excluded zone around the head, and protect and increase the protection of a normal mask. That is very useful. Under these helmets, you can't wear any kind of mask because you are totally surrounding. Just we use, as you see, a normal protective mask, but you can also choose to not wear anything because you are surrounding but a shield that protects you around.
Wow. I think it's really great to see that there's you're leaving no stones unturned in terms of safety for our patients. And I think when we say that we have this commitment to the safety of our patients, their families, our staff and volunteers, I think everything you're speaking to just symbolizes, shows, and demonstrates that commitment, Domenico. And I'm sorry, I'd hate to interrupt, but we do need to move things along a little bit. Is there anything is there anything crucial that we're missing from the things you're describing here?
I think that
I would like to add on to I just want to add on 3 small things that I think that actually it is a great learning for all of us. It's not just for Vietnam particularly, but I think that we're thinking making early and decisive actions. Taking early and decisive action, this is one very important thing, because as far as when the very first cases was happening in the country, the government actually is just really considered the COVID-19 as a major threat, even before the announcement from the WHO. So I think that's one of very good learning for us, because that's how we were able to control that a little bit earlier than others. And then they follow with different restrictions. Sterling Committee was set up, like multi-sectoral responses plans, and then they plan for different sort of plan, like plans that they're gonna cope with the COVID-19. So that's the first thing. The second thing, I think that the learning lesson for us is like we kind of have a capability to identify the target and make it very serious, without any exception. So any patients that contaminated with the positive COVID, or people stay in contact with COVID-19 patients, will be immediately to be quarantined, and all the treatments actually as of now are still provided free by the government. And then we set up a point of entries for border, airports, and extra. So I think that we identify good target, and we set serious restriction without any exception. And I think the third thing that's pretty much related to Operation Smile is, I think that first time, because of COVID-19, you see people work together, shoulder side by side, to treat patients. All the doctors, regardless where they're from, what kind of specialty they are, once they get into the hospital, when they've been, set into the situations that treating the patient with COVID-19, they treat them with dignity. They working side by side, working so well together. They are seeing the patient that they never met, and exactly, it just reflects a good reflection of the work that Operation Smile does. It's not just for Vietnam, but many other countries of Operation Smile around the world. Is we also would like to treat our patients, our children, people we never met, but we treat them with dignity. We treat them with the best service we are, with a good standard that the organization has. So I think that we reiterate the fact that, by working together, we will be able to make a difference. And by working together, by involving people in, we will be able to, bring in and creating more miracles. So that's one of the reasons why is that pushing Operation Smile in Vietnam into the states that we have to work with our in-country partner and key stakeholder to resume our work as soon as the COVID-19, situation is getting better. So that's led to the fact that we were able to do the very first 2 missions in the country. So that's good lesson learning for us.
Awesome, thank you, Viet. Ruben, one more question for you, and then we're going to kick into the Q&A portion. So we know that around 70 missions were postponed, and that led to about just under 10,000 patients waiting for surgery. How do we evolve to address the growing need moving forward? How are things going to change, and how are we going to pivot to be able to, one, not only keep our promise to each of those patients, but also to be able to continue our work into the future?
Yeah, that's the challenge, right? So I equate this to trying to land a plane on an aircraft carrier in the midst of a bit of a stormy ocean. So you're going to have to really adapt and become very, very innovative, and keep a huge amount of coordination and communication. And if you see if you hear any of the statements from Dr. Domenico Scopelliti and from Viet, you will quickly realize that even resuming activity does not absolutely equal business as usual. Domenico looks like an astronaut. He might as well be getting ready for docking to the International Space Station versus doing surgery in that picture that you showed. And the things that led to Vietnam even being able to do that were pretty significant. So when we look into the future, how we're going to tackle the huge amount of need out there that is now getting backlogged, a few things come to mind. One, we have to realize we're going to have to make even bigger investments. So we're challenged to acquire more resources, because I might not be able to get our teams with a spacesuit in a low middle income country setting, but we do have the responsibility to offer them with the protective gear that's required for them to do safe work and to remain safe themselves. So that requires additional investments, along with the plethora of other interventions and coordinated activities that we've mentioned before. So in terms of the innovative approaches, even the basic processes of offering care and standards now have another layer of how to do all those things, and what guidelines can we follow and what technology can we use to offer care in the midst of COVID-19. So Operation Smile has this very, very robust global standards of care, very, very detailed policies and procedures. And on top of that, we now have to create the guidelines that will allow and give answers, some of which Domenico has been in a very detailed way talking about as you show the diagram of how they're rolling out interventions in Italy. There is a need to have there's a greater number of partners and hospitals with whom we can engage, and we're going to have to figure out a way to turn the equation of 1 + 1 = 2 into 1 + 1 = 4. Right. We're going to have to figure out a way to make sure that every investment we're making to take care of the children also adds to the strengthening the health system. So what can we do to, as we take care of children, increase the preparedness and the ability to respond that hospitals and entities have with, with investments in equipment, in access to supplies, in better access to training? How can we use technology, the same way, I don't know, 10, 15, 20 years ago, we wouldn't be talking the way we are talking today, but we have the ability to use technology to still reach out to patients and connect with them and offer ongoing assistance in specific disciplines that might not require the physical intervention at a given moment in time. And it used to be that this benefit will only be in low resource environments, but now we see that in low income countries, a lot of our patients have phones in a way that they didn't have before. So we now have access to the villages and the communities that are remote. How can we continue to engage with them? Better coordination between all partners of civil societies. Different organizations are focused on different activities and different goals. We have to be talking to each other and working with the hospitals that are our partners to better align the sequence of interventions that we offer and minimize any potential disruption out of having 4 or 5 different agendas tackle onto one partner. We have to have a very strong relationship with the health department and our ability to connect our activities with the epidemiological surveillance of the entire country or region, and even add to it in areas where there's a need and we might be able to offer some assistance. I mean, you can keep going. Community awareness and response. A lot of us, when we talk about care, immediately gravitate towards what's happening in the hospital. But care can happen at the community level. It starts with education and spreading really good scientific-based information, factual information that can be understood in a way that can be understood by the communities to keep themselves safe or to know when to actually seek care. And we can use TV, radio, phones, social media, coordinate to continue to coordinate with community health workers and community leaders to prevent some of the hardships of COVID and prepare for the goodness of the interventions we offer. Anyway, I can keep going. At some point, we hope sooner than later vaccines will become available. So when that comes, what is the size of the programs that we can put together that would allow for us to still take care of the massive need with high quality, with great safety, while minimizing the potential spread of an illness like of the one that we're dealing with. So a whole world ahead of challenges, but if we focus on that commitment to children, we would unavoidably become really innovative in how we address the challenge. And we look forward to partnering with other organizations, to partnering with governments, to partnering with private entities, to civil society, and especially with the communities and the families, and most importantly, the patients, to see a way forward and an opportunity for all.
Awesome. Thank you so much, Ruben. And thank you to Viet and Domenico as well. We just so appreciate your insights and expertise and lending them to us on this call, this virtual event today. We're going to go ahead and roll right into our Q&A portion. So I will let Laura take over from here.
Thanks, John. And echoing the thanks to you guys, our panelists as well. A few folks have asked, will volunteers who come to medical missions be required to quarantine for 14 days before starting that mission? This was from Sarah, who I believe is from Vietnam, and then also Diana. So maybe Viet, on the missions that you hosted, were the medical volunteers required to quarantine beforehand?
Well, as of now, you might know the missions with the restriction from travel and everything, the mission will be conducting pretty much the local mission type of thing. So we're using the in-country's medical volunteers, so they don't have to be in a 14-day quarantine because they don't travel. However, they have to strictly follow all the guideline and the restriction from the hospital and also from the Ministry of Health Vietnam. For example, the very different thing that we have to do right now is in the past, if we do the mission, we'll gather about 100 patients and families, a few hundred of them at the hospital. Right now, with the situation, we only be able to bring in each and every day about 10 to 20 patients to the hospital every day. And we have to do the screening process as usual, it more time, but actually that's a very good way for us to protect the safety, to bring the safety to our patient family and also to our medical volunteers. We tend to use the medical volunteers, like in the past, you kind of bring in a mixture of volunteer from different hospital inside in the country. But as of now, we tend to use one team from one of that hospital only. And then we also asking people who actually follow to the hospital, they need to do the health and travel history, the correlations, even within the country, you know, where they've been to, then they have to declare in the form. Right now, they even download the app, and you can do it from your phone as well. The hospital require you to wear masks and keep a minimum social distancing with people. So as of now, you don't have to be entitled 14 days of quarantine unless you travel from overseas into Vietnam. But you know, we're not totally open yet. Just for a few cases that they come in, they will have to do 14 days of quarantine, and then also follow another 14 days of stay at home quarantine at home. But for the local mission, we're using pretty much 100% of our local medical volunteer and professionals, so you don't have to be doing that.
Thank you, Viet. And then Ruben, I'm going to direct this one at you. This is from Ricardo, a pediatric intensivist in Brazil. So he's wondering about the basic life support and pediatric advanced life support credentialing process that all Operation Smile volunteers must have. So he says that in Brazil and other Latin American countries, this credential can be quite expensive. And considering that all of the missions for this year in Brazil and potentially until January 2021 in Brazil will be postponed, will there be changes to the volunteer credentialing process when we are able to resume surgery? Or can you speak to that topic at this time?
Yes, and that's great, Ricardo. Thank you for that question. So a couple of things. We have been in communication with the American Heart Association as one of the authorized entities to roll out the training. We realize that as we look at the American Heart Association, it has given us the flexibility of extending the credential period for volunteers who already have the credentials. I think that we can be, the whole purpose is to maintain safety. I think that if a year from now we were to be able to restart and we haven't been able to offer the massive amounts of training certifications that we had, that we normally would, we would have to look at the risk of those type of gatherings and training, but also be really aware of the historical, historical pattern of performance of some of our incredible leaders and volunteers that we have around the world. If you have some anesthesiologists or intensivists or people who have performed outstandingly, as so many of them do, to tell them you cannot take care of a kid because you don't have these PALs at this stage, it becomes another challenge, another barrier. Remember that when we instituted PALs and ACLS and BLS as safety measures, were in excess of what was already being required by the current certifications and training that all these providers have. So I would find it really, I would be hard pressed to tell someone like Ricardo, you can't help us take care of a kid who's in need because I can't offer a pediatric advanced life support certification. So we have to be really thoughtful. And at the same time, as an organization, we would have to recommit to offering Ricardo and others the opportunity to get such certification at the earliest possible time. I hope that sort of answers it. Again, there's some evolving and been trends, but some of this knowledge through the certifications gets fine-tuned. But you know, as providers, we realize that experts like Ricardo and others are very aware of this knowledge, and this knowledge that doesn't go away.
Yeah, and Ricardo has said thanks and send my best to Ruben and Viet. So I think you answered his question. Yes. And kind of following that similar tune of thanks, I just wanted to again thank you, Ruben, Viet, and Domenico, for lending us your expertise and for sharing the learnings that you've had from resuming surgery and patient care in your countries. And to our audience, thank you all for joining. We will be sending out a recording of this event in the next day or two. And as always, just reach out to us if you have any questions. We're here to help. Anything else to add, guys?
Just a huge thanks to. Just a huge
We're
thanks
good.
to.
We just want to thank everyone to join together on this.
Yeah, and for accompanying us on the journey of trying to figure out a way to going back to taking care of children.
Absolutely.
Perfect.
Thank you so
All
much.
right. Thank you, guys.
Thank you very much, you guys.
Much.
All right.
I